Keith Yeates is a world leader in research on pediatric traumatic brain injury and concussion. His work has markedly improved clinical care and outcomes for children with brain injuries.
Hi, my name is Keith Yeates. I'm a professor at the University of Calgary, and today I'm going to be talking about how we tried to change healthcare for children with concussion. Just wanted to share that I do get grants and research support from CAHR, the National Institutes of Health, and Alberta Children's Hospital Foundation. I receive book royalties from 3 book publishers, and I receive an editorial stipend from the American Psychological Association. So concussion is a major public health burden. Millions of children and adolescents sustain concussions each year in North America. Concussions have been identified as a target for research by leading research and public health agencies across the world, including in Canada. Concussion is a hot topic, or at least it was prior to the pandemic, in the media, as well as in the scientific literature. The number of publications regarding concussion in the scientific literature has grown from around 100 a year to over 1,000 a year in the last 10 to 15 years. Even if only a small proportion of children have negative outcomes after concussion, it's clearly a major public health burden just because of how frequent it is. We've attempted to address the problems with concussion through the development of pediatric concussion guidelines, several that are specific to Canada, others that were published in the United States or as part of international groups. Unfortunately, despite the clinical guidelines, we know that there still remains significant practice variation and differences between healthcare providers and how they manage, identify, and care for children with concussion, as we showed in a paper we published back in 2019. We've attempted to address this inconsistency in care by implementing a clinical pathway for the acute care of pediatric concussion. And this is the project I want to talk about today. This was very much a team effort. I want to thank all of my collaborators who were part of this project. I also want to thank Alberta Health Services and their Maternal, Newborn, Child and Youth Strategic Clinical Network, who were active partners in the project. They helped fund the project through their Health Outcomes Improvement Fund. We also had funding from the Brain Canada Foundation, and I want to thank my many partners for this project that were at the University of Alberta. What we attempted to do in this project is take work that had been completed by an Alberta Health Services work group focused on acute pediatric concussion and translate it into an acute care clinical pathway. A clinical pathway is essentially a set of steps that are easy for providers to take that are involved in the assessment or care of a particular medical disorder, in this case, acute concussion. Our goal in the study was to determine whether implementing the pathway affected outcomes using what's called a stepped wedge cluster randomized trial. What this involves is essentially taking clusters of individuals with a particular disorder. In this case, they were clustered according to the particular site where they were seen. And then you introduce a particular intervention at standard intervals so that you have a period where everyone data is collected on all patients prior to implementation. And then you gradually implement the intervention at each of the sites, perhaps every couple of months, until finally the intervention has been implemented at all sites and you have data on what's happened after the intervention at all the sites as well. So our clinical pathway components involve 3 different items. One was a validated risk score that allowed physicians and nurses to quickly assess whether or not a child was at risk for persistent symptoms. They were able to use that score to refer children at high risk of persistent symptoms to specialized concussion clinics, but we also use the risk score to encourage physicians to refer children from acute care, from the emergency department, for follow-up care with their family physician. This is a standard recommendation that is thought to improve care and lead to better outcomes. We also had 2 standardized patient handouts, one with general information about concussion and the other with advice around returning to school and sport. And then we had a third piece, which was a web portal that provided much more detailed information about concussion and also provided a way of collecting data from individual patients on their outcomes. The 5P clinical risk score sticker, which was put on patients' charts, was developed empirically in a Canada-wide study that was published in the Journal of the American Medical Association in 2016. This 5P clinical risk score involves simple pieces of information: patient's age, their sex, their medical history, and the symptoms they report, and has been shown empirically to predict whether or not a child is at high risk for persistent symptoms. We rolled out the clinical pathway in 5 emergency departments over 2019, two of which involved large academic children's hospitals, 2 smaller community hospitals. These were all in Calgary and Edmonton. The implementation involved having a local physician and nurse champion at each of the sites. We conducted educational forums at each of the sites regarding the pathway, and we had a reminder system such that the 5P rule sticker, the standard handouts, and information about our web portal were put on the patient's charts at the time they were triaged for head injury. This helped serve to remind the physicians and the nurses to use the sticker and to give the information about the portal and the handouts to the patients. We started the rollout in January of 2019. We then had the first implementation of the pathway at one of the sites in March 30th, and then we subsequently rolled out the pathway at all the other sites every 2 months, and then had 2 months where all the sites had implemented the pathway. We're collecting data throughout that period. Our planned outcomes tended to focus on patient-centered outcomes, and particularly the time to symptom resolution. Unfortunately, we had very little use of our web portal and had very little data on patient-centered outcomes. And we learned a valuable lesson that high tech isn't always what families want. They really liked our patient handouts. But we did collect secondary outcomes on healthcare utilization and cost using data provided to us from Alberta Health Services, and that's the data I want to speak about today. So we found very little impact on return visits to ED. We thought we might decrease return visits, but it turned out they were very uncommon to begin with. We did, though, have a significant impact on follow-up outpatient visits. So across time, you can see on the dark black line is before and after the implementation of the intervention or the pathway. You can see a significant increase in the likelihood of 1 or more follow-up visits after the implementation of the pathway, with the proportion increasing about 15%. This is still lower than we would prefer, but certainly the implementation of the pathway made a significant difference. We also found that we didn't impact the total length of stay, the length of time that people spent in the emergency department. What we did is redistribute that time so that the time from the triage to when a physician actually did their assessment with the patients increased, but the time from when the physician did their assessment to disposition decreased. In other words, it seemed that we were able to make care more efficient, allowing the physicians to spend time with other, perhaps more acute patients, but also able to provide good care to the patients with concussion and get them back out of the emergency department more efficiently. We did this without causing any significant increase in physician claims at all but one site where there was a significant increase, but no other significant increase was seen at any of the other sites. So in conclusion, the implementation of the clinical pathway changed care by increasing the rate of follow-up, and this aligns with existing clinical practice guidelines. We also believe we made care more efficient and allowed the physicians and nurses to manage the patients with concussion in less time, freeing up time for other patients. Unfortunately, we don't know whether these changes in care improved patient outcomes, although substantial data suggests that the implementation of clinical pathways and the standardization of care are associated with better outcomes. And we have data to suggest that follow-up, the provision of follow-up care to children with concussion results in better outcomes. We've disseminated this through academic publications, but more importantly, we've been able to change the healthcare system provincially. Our handouts and our web portal were endorsed by Alberta Health Services. The handout is available province-wide. It's been used in the HealthLink phone line that's available to individuals in Alberta, as well as adapted on the My Health Alberta website. And they are considering adding the 5P rule scoring, a link to that tool in the electronic health record. The take-home messages from this project is that changing practice is hard. This is a quote from one of my research coordinators. Planning changes like this takes time and lots of input, and implementation takes buy-in from frontline staff. Clinical pathways need to be practical, feasible, and known to affect care in order to get buy-in. Simple handouts actually may trump fancy websites, and in our case certainly did. But it may be easier to implement decision and prediction rules with the implementation of an electronic health record. We believe clinical pathways definitely have the potential to change care, and the question then is whether we now can move to altering how concussion care is provided in primary care. I want to acknowledge all of my collaborators and agencies that provide support to my research, and thank you for your attention.